I'm still working on it.
That'd be a good
time. Okay, Democrats on Capitol Hill unveiling their version of health care reform, but not everyone's on board.
Joining us this morning, Utah Congressman Jim Matheson. Did they used to call you Jam Master Jay back in the day?
I've never been called that. What can I say?
Well, until today.
I've been called worse.
I asked if you had been. I didn't say that was it. Okay, so there are a couple of versions now, and it's really confusing to a lot of constituents here in Utah because we're all trying to figure out, okay, there are a couple of versions. One came out of a committee, and is that the one we're actually going to vote on? So there's a House version, there's a Senate version. You don't like the House version. What do you like about the Senate version that you didn't like about the House version?
Well, you're right that it's confusing. And actually, there are two Senate versions, just to confuse a little more. But I think the key on this is what are you really trying to achieve? And the problem in our healthcare system today, there are two big problems. One is we got about 40 million people who don't have health insurance, and everybody else is paying for that. So we got to fix that. And then the second thing is the costs are growing so much greater inflation every year. We're going off a financial cliff if we don't reform our system to make it more efficient, more cost effective, and get rid of that excessive growth in costs. So all these other complicated issues with healthcare, there are dozens and dozens of variables, but those are the top line issues. And in my opinion, the bills that are going through the Senate tend to achieve those goals better, and that's why I'm leaning that way.
Both of those that are going through the Senate?
Yeah, I think one is better than the other. And by the way, ultimately the Senate's going to vote on something different from both of them, you know, just to make this even more confusing.
Okay.
They're trying to meld those bills together. We haven't seen what the Senate product's even going to be yet. But the House of Representatives has got their product that they're going to bring to the House floor probably later this week.
Okay, and a public option. You don't like a public option?
Well, I'm concerned about most versions of a public option. First of all, we again step back and say, what are we trying to achieve here? The idea is to create competition with private health insurance. There are a lot of ways to do that, and I think we should. A couple of states right now, Washington and Wisconsin, have member-owned co-ops. It's not a government-run health care, but it's a nonprofit member-owned co-op, just like credit unions here in Utah. So there are other ways to achieve this, and that's what we ought to be looking for. Is, yeah, we want more competition and more choices for consumers, but a one-size-fits-all program out of Washington, I'm not sure that makes sense.
Okay, yeah, and Representative Bishop and Chaffetz both like just an option where the states get to choose what they're going to do individually. You like that idea?
Well, I think that needs to be a piece of the puzzle. There's no question. The demographics in each state are different. Utah has the lowest smoking rate in the country. Mississippi has the highest smoking rate in the country, just to take one extreme example. So having a one-size-fits-all program for the whole country may not fit the healthcare demographics of different parts of the country. We're the youngest state in the country. Florida's the oldest state. There are just a lot of ways you can look at it. You say, yeah, maybe a one-size-fits-all approach doesn't make sense.
Okay, so that sounds like you support a health insurance exchange or something. Isn't Utah currently trying a pilot program like that right now?
There are only two states that have these exchanges, Massachusetts and Utah. You can go online and look at the different choices. That's a great idea. The House of Representatives bill has one national exchange. The Senate bills have state-based exchanges. I think doing it at the state level makes more sense. So there's another example of where I think the Senate's going in a better direction.
You know, these bills are so enormous. I mean, you're saying it's up to 2,000 pages.
Yeah.
So how do you read all that, take it all in, study it, and make a decision on that, an informed decision to be able to vote on this
You're
stuff?
asking a great question. It's very difficult to do that. I happen to be on one of the committees of the House of Representatives where this bill was moving through to begin with, and so a lot of those 2,000 pages I've already seen because I have the benefit of being on that committee. But for the rank and file member of Congress to have a 2,000-page drill dropped on you and say, guess what, you're going to vote on this in 3 days, that's a daunting task. And you've got to rely on your staff collectively to read together with you and go through the different sections of the bill. But this is a very complicated issue. In fact, I bet you it's going to be the most complicated issue I ever worked on in my career. And it's a really important issue, and we want to get it right. But, yeah, that complexity is pretty challenging.
Okay, before we let you go, then, do you think we will pass something? There will be a health reform bill that will pass?
I think ultimately there's going to be a health reform bill that gets passed and gets signed into law by the president. It may not happen until December, January, February, but yeah, I think it's going to happen.
Okay. Boy, we're going to keep on talking about it, too.
Okay.
Thanks.
Thank you.